Ms. Brown, welcome. You have 3 bills on suspense: AB 348, AB 710, AB 1518. What's your pleasure?
I would like to present 3 of those bills. AB 710 first.
Please continue, Ms. Brown.
Thank you, Mr. Chair and members. AB 710 would re-include youth involved in the juvenile justice system to the local control funding formula. What happened was during a budget trailer bill session, they were dropped out. So we're asking that you will consider this bill as we move forward on the suspense file.
Thank you, Ms. Brown. Your next bill. Oh, wait a second. Witnesses in support.
Oh.
Individuals from the public in support.
Good morning, Mr. Chair and members. Pamela Gibbs, representing the Los Angeles County Office of Education. We strongly support this measure. We do support and educate many of the probation youth in our county, but know that they need services when they leave our system. So we think the benefit of this bill would result in long-term savings to the state as a result of providing detailed information as to how they're being served. So we urge your support. Thank you.
Thank you so much. Any other individuals from the public in support? Witnesses in opposition? Individuals from the public in opposition? Questions or comments from the committee members? If not, Ms. Brown, would you like to close on AB 710?
I ask for your consideration as it moves to suspense.
Thank you so much. Your next bill?
Next bill is AB 348. I understand that this is a candidate also for suspense, but I wanted to clear any misinformation that may exist about the DPH investigations, Department of Public Health. I want to preface my remarks with a deep appreciation for the care, support, and security that most nursing homes provide. Their administrators are remarkable people, and they do a good job. However, there are times when trouble occurs. Sadly, despite the dedication of most nursing facilities, neglect, mistreatment, and abuse are an unfortunate reality for far too many Californians who reside in nursing homes. It gives the entire industry a bad reputation. Residents suffer from bed sores, dehydration, falls, sexual abuse, and hospitalization, and sometimes death. California enlists highly skilled and trained professionals to investigate when accidents are reported. Excuse me. After 2 oversight hearings detailing poor management and poor leadership, and with the Bureau of State Audit's report with the similar findings, self-assessment costing taxpayers $250,000, the backlog of uninvestigated complaints continues to grow. Now there are over 12,000 cases. It's time to place a time frame on these investigations and to resist assertions that timely investigations are unachievable. AB 348 establishes a 45-day time frame along with a 30-day extension if necessary. This is a standard in acute care hospitals, and all we have to do is just add this standard to our nursing homes. With me today, I have 2 witnesses, Mike Montgomery and Endeavor Doctor, who will speak.
Thank you so much. Your witnesses, please.
Hi, Mike Montgomery, Congress of California Seniors. We think this bill will save the state money. With the backlog of 12,000 uninvestigated complaints, it's inevitably going to lead to lawsuits, remedial costs, bad publicity. It'd be nice if the complaints could be investigated immediately, but the 45-day deadline is precedent. There's money for it in the governor's budget. We support the bill.
Thank you so much. Next witness.
Deborah Doctor from Disability Rights California. We have an investigation unit, and my testimony in part comes from their experience. We've seen investigations, including deaths, take as long as 7 years. We've seen other incidents where deficiencies are left uncorrected while that time period goes by. And I'm just going to ask you to picture one real scenario, and if this were your grandchild or child. In one facility, a 4-year-old boy died because he pulled out his breathing tube. And while the investigation remained open, which took 3 years to complete, a 3-year-old girl died of the exact same thing in the very same facility. These things are preventable if investigations are completed in a reasonable time frame. And we ask for your aye vote on this bill. Thank you.
Thank you so much. Any other individuals from the public in support?
Good morning, Mr. Chair, committee members. Joe Rodriguez. I'm the California State Long-Term Care Ombudsman in strong support of this measure. Residents who are abused and neglected shouldn't have to wait for 4 years to have their complaint investigated. I ask for your support.
Thank you so much.
John Joseph with AARP California on behalf of 3.2 members, a million members in California in strong support.
Thank you so much.
Good morning. Aaron Lewis for the Consumer Federation of California in strong support. Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Thank you so much. Any witnesses in opposition? Individuals from the public in opposition? Questions or comments from the committee members? If not, Ms. Brown, would you like to close?
Members, on behalf of the California nursing home residents, taxpayers, constituents, and voters, I seek your aye vote. Thank you.
Thank you, Ms. Brown. This bill is on suspense. It's not a candidate because candidate implies that it is and it isn't, but it's a suspense file.
I just thought I could maybe change the trajectory. Yeah.
I was almost there. You had me. Ms. Brown,
yes.
Thank you so much on this bill. Would you like to present your other bill?
Yes. I'm going to present 1518. And 1518 will wean our state off the default and most expensive setting of long-term care in favor of less restrictive settings in the community. Nursing homes throughout the state provide an important service to medically dependent individuals. However, oftentimes people who have long life medical needs choose to live in the community, and that was a right that was affirmed by the Olmstead decision in 1999. Community life offers a measure of independence and the opportunity to self-direct their care. And that's why we have the nursing home Medicaid waiver. Medicaid waivers allow states to deliver and pay for health care services with federal government waiving some of the rules. Medicaid 1915 waivers allow the states to provide long-term care services in home and community-based settings under the Medicaid program. There's a problem. We have a maximum of about 3,500 slots in the state. There are 70,000 on Medi-Cal in nursing homes in any one day, and 25% of them would like to be at home or be in another facility. So the fix is to increase the number of slots. AB 1518 would increase the number of slots in the waiver to be commensurate with the number of people who could benefit from this or who desire an alternative. I invite Dr. Deborah Doctor, representing Disability Rights California.
Thank you. Please continue.
Thank you. And I want to thank the Aging and Long-Term Care Committee. This is their bill, and we are the sponsors of the bill, which has had no opposition. And I want to comment on the accurate analysis about the cost of this bill. It is inherently cost neutral. We are not asking for the state to spend more on these services. It's inevitable, the way the bill is constructed, that the state would spend less or no more than it spends on people and institutions. Right now, we have people who are costing the taxpayers about $72,000 a year in nursing homes who can't get out. So we all are paying for a higher cost of care when people want to be in the community. Yesterday I heard that now though even the wait list is closed and there are people in nursing facilities who can't even put in an application to get out. We have people waiting in the community for 2 years to get these services. We also have young people who age out of EPSDT when they're 21, young people with severe disabilities who need nursing care. And when they turn 21 and they age out, they get a letter from the state that says, "Happy birthday, you're about to lose half your services." They didn't get better when they turned 21. They aged out into this waiver, and they have suffered, and their families have suffered. This bill, at most, is cost neutral, and I believe, having been in this field for 35 years, that it will save the state money when, as Ms. Brown says, we do what's right and lawful and responsible to the taxpayers and increase the use of home and community-based services. This is parallel to what is going on in the developmental disabilities system. They are way ahead of the rest of the state. They use an aggregate cost cap. They have 116,000 people on their DD waiver this year, while we have 3,600 slots for people in nursing homes. So I ask for your support, and thank you for letting me speak.
Thank you so much. Any other individuals or witnesses in support? Individuals from the public in support?
Good morning, Braden Obrowski on behalf of the California Association for Health Services at Home and Support. Thank you.
Thank you so much.
Good morning, Kim Rutledge with UDW, AFSCME Local 3930 in strong support today. Thank you.
Thank you so much. Any witnesses in opposition? Individuals from the public in opposition? Questions or comments from the committee members? Ms. Brown, I would like to just say that you're doing a great job being an advocate for some of the most needy folks in our state, some of the folks that don't have a voice in Sacramento. And so I greatly appreciate you coming here to present on your suspense candidates and fighting for the folks, especially in the silver tsunami that will be upon us. So thank you. Would you like to close, Ms. Brown?
Thank you so much. Thank you on behalf of the thousands of older and disabled Californians who seek a chance at just community living, to live in their own house, to be comfortable. And I seek your aye vote whenever you consider it, as it comes off of suspense.
Ms. Brown, thank you so much. It's on suspense, but we'll definitely give it due consideration. Thank you. Mr. McCarty? You have one bill, AB 47, that's on suspense. And I'm assuming you're here to present on it.
Or a candidate for suspense. Can you educate me on what that means?
It's on suspense.
Okay. Thank you. Yes, just one bill this morning. Good morning, Mr. Chair and members. I'm here to present AB 47, the Preschool for All Act, which requires the state to provide funding for all low-income children eligible who qualify for the state preschool program. As we know, a powerful body of research shows that investing in quality early education is highly effective in promoting student academic success, 2, preventing kids from entering the juvenile justice system, and 3, fighting poverty. We would like to work with the committee staff on identifying more precise numbers relating to the potential number of children that would be impacted and affected by this bill. Lastly, this legislation helps fulfill last year's commitment from the governor and the legislature to expand state preschool for all low-income eligible families who do not have access to 1 year of state preschool, transitional kindergarten, or Head Start in the current system of pre-K in California. With me today, I'm joined by Deb Kong with Early Edge California, our sponsor, and Matt Regan with the Bay Area Council to testify on this legislation. Thank you for your consideration.
Thank you so much. Your first witness in support.
Mr. Chair and members, thank you for your consideration. consideration of how to strengthen California's early care and education system. My name is Deborah Kong. I'm president of Early Edge California, sponsor of AB 47. There are a couple important fiscal considerations to take into account that could reduce the cost that is in the analysis dramatically. The first is that the universe of eligible children in any voluntary program, particularly one for young children, is considerably lower because not all parents choose to participate. The second is that the universe shrinks dramatically when you remove 4-year-olds who are in Head Start and transitional kindergarten already. I also wanted to highlight a new report that was released just this week by the Stanford Center on Poverty and Inequality. It highlighted early childhood education as a key way, an unprecedented opportunity to reduce poverty in California. It cited early childhood education as a key component of an equal opportunity plan to reduce poverty and prevent lifelong achievement gaps by increasing the number and quality of early education slots. So the result is less poverty, a stronger economy, and less spending on social services. Thank you.
Thanks so much. Your next witness.
Chairman Gomez, committee members, my name is Matt Regan. I'm here representing the Bay Area Council. We are a business-sponsored public policy advocacy organization comprised of about 300 of the largest employers in the San Francisco Silicon Valley region. According to the latest Franchise Tax Board data, we have about 20% of the state's population and just produced about 40% of the state's income taxes. So we know that knowledge-based economies are successful economies. We know that they help balance budgets. But our problem in California is that we fail to produce enough high school graduates to meet the needs of that knowledge-based economy. And why is that? Well, we looked back into the early years and reverse engineered the problem. It's not necessarily all on the heads of high school teachers. We know that a third of kids entering kindergarten in California currently lack the basic skills to compete with their peers. They lack the social-emotional skills, the self-regulation and cognitive skills to meet the levels required of them in kindergarten. The solution is to invest earlier, upstream. We know that a child's brain develops all of its architecture in the first 5 years of life. We also know that investing in the early years produce significant returns to state coffers. According to the President's Council of Economic Advisors, that's an average of $8 to every one invested. It can go as high as 16 to 1, according to the data and research done by Nobel laureate James Heckman. That's for the kids most at risk.
Thank you so much. 30 seconds.
Okay. So the savings come from reduced grade repetition and need for remedial education in our kindergarten, in our K-12 system. So we would urge an aye vote. It's good for our kids, it's good for our economy, and it's good for our state. Thank you very much.
Thank you so much. Any other witnesses in support? Individuals from the public in support.
Tim Fitzharris, Los Angeles Universal Preschool, in strong support.
Brian Howe, on behalf of United Ways of California. We're a network of 34 United Ways in the state. We're in strong support.
Trudy Schaefer, representing the League of Women Voters of California, in strong support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support.
Thank you.
Good morning. Khadija Alam Javed with the Advancement Project, in strong support, and urge you to move this off of suspense when appropriate. Thank you.
Thank you.
Good morning, Leangela Reed on behalf of the Santa Clara County Office of Education and their Strong Start Coalition, as well as the Butte County Office of Education in strong support.
Thank you.
Les Shepard representing the Silicon Valley Community Foundation in support.
Thank you.
Brendan Tuig on behalf of Cadango, an early childhood education and early care provider in the Bay Area, in support. Thank you.
Monica Miller on behalf of the Jewish Public Affairs Committee of California in strong support. Thank you.
Thank you so much. Any other individuals in support? Witnesses in opposition? Individuals from the public in opposition? Questions or comments from the committee members? Mr. Bonta.
Thank you, Mr. Chair. Mr. McCarty, I just want to thank you for your leadership and your passion and your commitment on this issue and bringing AB 47 forward. We obviously have a tremendous need in California to strengthen our early childhood education programs throughout the state, and this is a bold measure. I'm proud to be a co-author and a partner with you in moving this forward. And you referred to the strong and robust body of evidence that exists that dictates the need need for this policy, from the 30 million word gap to all sorts of other data and evidence. And I think this is a solution that we should all get behind, because it's based in data, it's evidence-driven, evidence-based, and will make a huge difference. We know that there are strong inequities that are already existent before our young people, our young Californians get to kindergarten. So I appreciate your leadership, and I also want to give a special shout out to the Bay Area Council. This isn't something that the business community has always been supportive of, and I appreciate your leadership and bravery in stepping forward and making the business case for early childhood education. So thank you for that partnership and support.
Thank you so much. Mr. Wagner?
I'm going to confess to being a bit confused. If the problem here is we need our students to have remedial work, and they just are not, by definition, not performing as well now as they were before, and the way to fix that is this new billion-dollar program, I guess my question would be, what were we doing before that didn't cost $1 billion that we're not doing now that makes us need this new billion-dollar program? Shouldn't we look at some of the underlying causes first and maybe fix the schools and spend the money on the schools rather than creating new programs? Because we were at one point doing something that worked. That's, by definition, the reason we need remedial work now. So what were we doing that didn't cost us $1 billion, and why not go there instead?
Well, the simple answer is that this is not a new program. This is the California State Preschool Program, where we have 150,000 low-income kids enrolled today. Unfortunately, there's not enough space to serve all the kids who could benefit. So in California, some kids are able to go to TK. If you happen to be born between the months of September and December, you get a free year of essentially universal preschool. If you're a very low-income family, you can qualify for Head Start. Or if you're in kind of that middle gap, you can qualify for the state preschool program. Unfortunately, we don't provide enough resources, and too many kids start kindergarten behind. As Mr. Bonta said, this word gap is there from the day they enter kindergarten. So, there are plenty of issues to address the achievement gap, but I think, research shows that if you penny for penny, pound for pound, this is the best place to invest as far as trying to close that achievement gap.
Thank you. Mr. Garcia.
Thank you, Mr. Chair. I just wanted to thank the author, and I too echo the sentiments of Assemblymember Bonta for your leadership on this issue. It was mentioned earlier that a bill that came before us, there was a budget item in the May revise. I was quite pleased with the investments that the May revise is making towards higher education, but displeased with the lack of investments in the early childhood education area. I'll repeat what the chairman said. Maybe the governor proposes the budget, but we approve it, and I'm hoping that at some point we will make the investments necessary to the early childhood education for all the reasons that have been mentioned by the comments of our members and your witnesses. I think this addresses significant amount of issues that we see in our low-income communities. And again, I applaud your efforts and glad to support this effort.
Thank you so much, Mr. Garcia. Any other questions or comments? If not, Mr. McCarty, would you like to close?
Just thank you for the consideration. I hope this is a candidate to come off the suspense, file the appropriate day.
Thank you so much. We'll give this bill due consideration. Like I said, bill is either on or off suspense. There is no candidates. Thank you so much.
Thank you.